pasikana na maji ga kuleta haga. Kweneso pakutaya vintu tayani pamalo gaweme yene avo gakuzomerezeka. Sungani malo gakuzingirizga na hapo mkukhala mauchanda nyengo zose. Sukani vipaso na mphangwe yene izo mwanyengo zose sikwenekera kuwa za kwenerera kweneso muchite ivi pakuteveteska maji gaweme pambele mndayambe kurya. Usange mwana panji waliyose wachibale wasangika na matenda gapamtima panji wakubokola kupya tupi chimbilani nao mwalwilo kuchipatala cha pafupi na uko mukukhala kulindiza yayi. Bapapi bose mkuchisikika kuti munyengo hii mungateveteska ovwili wakumanyikwa kuti oral hydration salts panji kusazga maji gaweme muchere na shuga kuwaliyose wene uyo wasangika na batenda gapamtima panyengo yene iyo mkupengaso ovwili ovya umoyo. Tieni titevetele pamo pakujivikirira kumatenda ngeti ni aga munyengo ya maji ya kusefukira wene awa kwaska bumalino la Lundazi.
Hello, dear listener. Thank you so much for joining us. This is Kanele 97.7 FM. We are broadcasting to you live from plot number 137 at Aribu Sheds here in Lundazi. We have a special program today. It is very important because our main focus is addressing concerns and rumors circulating in our respective communities regarding water being distributed by water bowsers and allegations that it is causing diarrhea diseases. As you may be aware, due to the current situation in the district, water bowsers have been deployed to ensure communities have access to safe drinking water. However, there have been concerns and misinformation that this water is unsafe. To clarify these issues and guide our communities on how to prevent diarrheal diseases, we have a panel of experts with us today as we get to discuss this. Let me take this opportunity to get to introduce the District Surveillance Officer, Mr. Stephen Banda, who's in picture for some of you that are watching on our Facebook page right now. Also, we do have Eastern Water and Sanitation Company Manager, Mr. Yotam Nirongo, not forgetting the Water and Sanitation Coordinator from Lundazi Town Council, Mr. Bunda Kalua. Then we also have the District Health Promotion Officer, Mrs. Messi Piri Muke. Thank you so much, gentlemen and the lady, for joining us on the program. You're welcome to Kanele FM.
Thank you. Thank you so much.
Thank you. All right. To begin with, I would like to ask the District Surveillance Officer to briefly explain the current diarrheal disease situation in the district and whether there is any confirmed link to water from the bowsers.
Thank you very much, moderator. Good afternoon, viewers and listeners. Yes, of course, as a district health office, I think there are a lot of rumors running around following the floods that we experienced. Yeah, so in terms of the trends for the diarrheal diseases, maybe what I can start by explaining is that as a surveillance officer, we do monitor all notifiable diseases day in, day out. We monitor them. Okay, yeah. So, as the case may be for diarrhea diseases, of course, diarrheal diseases are there. We have recorded some diarrheal diseases, but not to an alarming stage where we would even start, recording to say we have an outbreak of diarrhea. You may wish to know that last year, around September, October, and November, we've had high numbers of diarrhea cases But for us, it is not just to record the numbers. There is what we call case area targeted interventions. So one of my role or my job is to ensure that I monitor these diseases, and each time I see a spike, because there are some techniques that we use. Graphs are some of the techniques that we use to see whether there is a spike in terms of the numbers of diarrhea or not. So each time, anytime we see that there is a spike, then it means we have to analyze our information in terms of the area that is affected, the people that are affected. Are they children? Are they just women? You know, what type of people? Maybe there are those that are mobile, you know, things like that. And then once we analyze like that, that also helps us now to put up interventions in place. That's how we come up with the area targeted interventions, actually. Okay. So we may not put interventions like, you know, one size is fitting all. Yeah, so that kind of an analysis where we look at the places affected, people affected, they help us actually to target our interventions.
All right. I know you're explaining in general of what you do when it comes to diarrheal diseases or cases.
Yes.
Let's get deep into what is prevailing now. What have you found out?
Okay. Yeah, so in terms of the analysis that we have done so far, yes, of course, there's been a slight increase in terms of diarrhea cases. Okay. And most of the areas that these cases are being recorded, of course, it's the catchment areas of the urban health clinic and also Mwase. But now, if we are to compare, that is why I started by giving a trend. Sure. If we are to compare with the numbers that we had, for example, in September, October, November, we had high numbers than the numbers that we are having now. Okay? So that is the trend which is there. If we are to compare in terms of the numbers. But of course, diarrhea cases are there. But allow me also just to mention right from now that we've been hearing stories where others are even insinuating that, no, maybe it's cholera and the like. We haven't yet recorded any kind of cholera in Lundazi. But of course, diarrhea cases, they're there. Those that are passing through our facilities. But I must take this opportunity also to encourage our communities that if they are seeing these diarrhea cases, it's not just an issue of them talking about them in wherever they are staying, but they should come through the health facility or indeed find ways of giving us this information so that we come to that particular village which is affected to verify whether the stories that we are hearing are true or not.
You've spoken of the urban clinic and Mwase being the center of these numbers that you have recorded in as far as diarrheal cases are concerned. What further step have you taken in assessing?
Places we need to start pinpointing where are these cases coming from. For example, under urban setup, we would say, okay, we have Dunda, we have William, we have Mtendere. We need to go that far. And once we know that these cases are coming from Dunda area, for example, like right now, we know that we have some cases from Mtendere, Riverside, you know, Chipiola. So we've distributed chlorine in those areas. And we are also, that is household chlorine, okay? Then we know that in these areas, the issues of water is actually a problem. People are accessing water, others from the shallow wells. We have also chlorinated, shallow wells in these areas. And we are not just doing these activities without giving messages. We are also giving messages. Okay, for example, just the domestic chlorine, we are not just giving, but we are also explaining in terms of how they should use it. Apart from that, there are issues of also hygiene, personal hygiene, because we may not just go there, we distribute chlorine without talking about hygiene. Otherwise, even when you have chlorine at home, if one person does not practice personal hygiene, even for the chlorine that you've been given, it may not work effectively because, you are not exercising, cleanliness at home.
All right.
Yeah, so we are encouraging our community members that even when they receive, the messages that we are giving, they should put them into practice. Even when we give them the liquid chlorine, even when we coordinate their sources of water, they should still exercise personal hygiene always. It's very important.
All right. There has been allegations that this could be as a result of water that people have drawn from water bowsers. Based on your investigation, what is the outcome? Is it true that some of these cases could be attributed to the water that is being provided by these water bowsers?
Yeah, not necessarily that. I'll allow my colleagues also to come in and explain on that one.
Okay.
But what we know and what we've been doing ourselves is that, together, of course, with our colleagues, is that the water that is being distributed is being chlorinated. It is being chlorinated. It's not just, we don't just leave it there. There is also what we are doing, what we call free residual chlorine test. So I can explain on this one.
Okay.
Of course, my colleagues, they'll come in. This is where, once the water is chlorinated, even the water that we receive through Eastern Water, I know Eastern Water will come in and explain. They usually chlorinate their water. But they don't just leave it there. They need also to test at the end where someone is receiving water, whether the chlorine, the amount of chlorine at the end of the tap it has the amount that can actually deal with any kind of germs in water. So just to explain now on the water bowser that we have some of our environmental technologists who've been sampling water here and there to see if the water from the bowsers has the required amount of chlorine that can actually help to kill germs.
Okay.
And so far, we have not received any information that would suggest that the water is not treated with chlorine.
All right.
Yes.
Maybe Mr. Nyirongo can come in. This is your specialization.
Yeah.
Others are alleging online that they could be suffering from diarrhea diseases as a result of the water that they may have received from the bowsers that you're providing. Before this program, we had another one where we spoke about the processes that you undertake in order to ensure that this water is clean and safe for the people that are going to consume it. Just kindly share with us that kind of a process and just an assurance that this can not be as a result of this water you're providing.
All right. Thank you so much, moderator. Yeah, so just to add on what the surveillance officer, Mr. Banda, has started explaining, the water treatment process is quite an extensive one, where we talk about the whole treatment process in a situation where it is well established. Okay. So we have two types of sources of water. We have what we call surface water source. These encompasses places like the dams, like our dam that we have, which has been washed away. We also have the streams, where we get water from the streams. Those are some of the examples I can give in terms of the surface water sources.
Okay.
So these sources have got a specific treatment process which they have to go through, so that the water is certified safe for human consumption. So if you happen to have passed through our treatment plant, you realize that the water has to pass through what we call the sedimentation process. From the dam, it will have to come through the sedimentation. Then we add what we call a coagulant, which is aluminium sulfate, which will help to actually remove the suspended particles to ensure that we have reduced turbidity levels. Yeah, turbidity, I think we've been talking about this. I remember on the fora, some people were saying, what is turbidity and all that. So turbidity is just the measure of how cloudy the water is. Yeah, so we are just looking at how much dirty the water is. So we have to measure that so that we are able to quantify the dosage in terms of aluminum sulfate, which you need to add there so that we reach the recommended levels in terms of the turbidity.
All right.
So when we do that, you find that it does not end there. The water has to pass through the filtration process as well.
Okay.
So after the filtration process, we expect that the output in terms of the clear water has to be at least not more than 5 NTU. These are the units that we use to measure turbidity.
Okay.
So when we see that there is that 5 NTU, that is when we are safe to say this water is adequate.
Okay.
But at that point, it's not fully adequate because it has to be disinfected.
All right.
Because in those processes that the water is passing through, we could have some microorganisms, bacteria, and other issues that may be present in the treatment process. So disinfection is the last point of water treatment.
Okay.
And disinfection, we use chlorine to disinfect the water. And that is what we use to ensure that we have the levels that we want. So at the treatment plant, we always check the levels of chlorine to ensure that we have adequate levels, because World Health Organization has prescribed how much chlorine should be in water, which should not harm a human being.
All right.
So at the treatment plant, we check, as well as when we distribute in the distribution network.
Okay.
So that which I gave was the process which we use when we are using a surface water source.
All right.
Yeah.
I know you've mentioned 2 sources of water.
Yes.
In this aspect, which one are we using? Are we still getting water from streams?
Okay.
If they're there, which streams are these? How safe are they as well?
Yeah. So actually, I was coming to that, moderator. So in the absence of the dam, the way we saw that our dam was washed away, 2 boreholes were drilled.
Okay.
So this is another type of source of water which is used for human consumption. So this one is underground water or groundwater source.
Okay.
So the groundwater source is the type of water which we get from boreholes. Yeah. So we do have some people use shallow wells, and so on. So the groundwater source, the quality of water we get there is different from a surface water source, because this is the water that we get from the upper. When we drill down there, you find that there is natural filtration taking place as we get the water out of the ground. And usually, the turbidity levels for groundwater source are usually less than 5. And it's very rare that we make it go through the process of filtration, because already the levels of turbid or the suspended particles is less than that is, it's not alarming in short. So the only treatment that we subject that water to is the chlorination process, where we add chlorine to ensure that the water is disinfected, and that chlorine should also meet the required standards.
All right.
So
have you had a situation where, with all these processes followed, you still have water that is discolored?
Usually we do have certain situations, for example, in the rainy season. Yeah, it's common in the rainy season because the load in terms of turbidity levels is higher. So that water which has got a turbidity, for example, of more than 1,000 NTU. And for you to bring down the 1,000 NTU within the process, sometimes it becomes a bit tricky. That is when you see that some people in the community would actually experience some turbid water coming to their taps, but it does not take long, because in the process of trying to purify it, we get to arrive at a correct dosage.
Have we reached that level after this disaster?
So to be clear, we are not using the surface water source.
Oh, okay.
Yes. So I have to be clear on that, so that people can get it very clear that we are not using the surface water source at the moment, because we have not yet revamped the treatment plant.
Okay.
Yeah, we are still working on modalities on how best we can get back to the treatment plant and probably use the surface water that we have. But for now, we are using the groundwater.
Okay.
The 2 boreholes that we are drilled, and those are the ones we are using for the water bowsers.
Ah, okay.
Yeah.
Maybe let me get to Madam Muke. I don't know the process that you undertake as the Ministry of Health in ensuring that what Eastern Water and Sanitation Company is providing to the community now is clean water. Have you put in place measures in just ensuring that what they have explained is what is being done, and people are getting the rightful water that they deserve during this particular time?
Okay. So thank you so much. What we are doing as Minister of Health is when the bowsers go around to distribute water, there's a team that goes also together with the bowsers to test the quality of the chlorine that is in the water. And so from the results that we receive, it's that the chlorine that is there is actually the normal chlorine that is supposed to be in the water.
Okay.
Yeah, so that is to make sure that our households are having water that is safe. Yes. Then also to supplement that, we are giving households liquid chlorine so that they can always water at household level.
Is that already treated water? There's already chlorine there. Someone to add more chlorine, doesn't that now amount to something that can have an effect on their health?
Not really, because the percentage of the chlorine that we put there is of 0.4.
Okay.
It's a range actually.
It's a range.
Yeah, 0.2 to 0.5. That is what is expected to be at household level.
Okay.
Yeah.
So they can still add more chlorine,
Actually,
even if you have already put.
So maybe just to supplement on what Madam Messi was saying, the purpose of giving the liquid chlorine goes beyond the water bowser water that people get.
Okay.
Because you find that our supply is not frequent. So they will get water maybe in the morning, maybe by afternoon that water is finished, and the water bowser may not go back there. So these people may still be prone to getting water from other sources.
Okay.
So that chlorine is meant to supplement in case they go to other sources other than the water bowsers.
Great.
Yeah.
Maybe let's bring in Lundazi Town Council in this picture. I know you're already in this picture, but just share with us your part in ensuring that the commodity that is being taken out is what is required. Just bring us up to speed what part you play in ensuring that this is met.
So the part of Lundazi Council is to coordinate.
Okay.
Yes, knowing that we are going the decentralization way.
Mm-hmm.
So we are working with the Eastern Water and Ministry of Health and all other partners. Yes, we are currently being supported with a lot of partners. Yes, so in ensuring that people are accessing clean water, we're working together with Eastern Water and MOH. So in terms of operation of the water bowsers, yes, so before we started distribution at first, we were drawing water from the clarifiers from the Eastern Water plant.
Okay.
So before we had started, we had first disinfected the water bowsers, the tanks.
Okay.
Yes, and we made sure that we clear the water, whatever the dirtiness which was in the water bowsers, so that the people can receive safe water. Yes, and then what we do thereafter is there's a solution we make for chlorine. Yes, which is, I'm sure you've heard the range. Yes, so we put the solution in the water bowser. As water goes into the water bowser, they mix.
Okay.
Yes.
So meaning these water bowsers are adequately prepared. They're cleaned and everything is done.
Yes.
It has nothing to do with them having treated water and then they just pour in these water bowsers.
Yeah, most of the times people get the notion that groundwater is safe water, but still us, we are going ahead and chlorinate the water.
Oh, great.
Yes, and then to ensure that this is really the range we're looking for. After drawing the water, I'm sure you've seen at the plant there, so it's just a deliberate move where the water bowsers move that slope.
Yeah.
And then go and again test if it's the rightful range we're looking for. And then in the same sense, also our colleagues from Ministry of Health, they follow the water bowsers in their distribution points to go and see and to check if people are accessing clean water.
All right.
So in this case, we're working all of us together. We're putting our heads together to ensure that people are getting or accessing clean water.
All right. In case you've just tuned in, this is Kanele 97.7 FM. We are hosting Ministry of Health. There's also Eastern Water and Sanitation Company. Not forgetting Lundazi Town Council, well represented here as we look at issues and concerns surrounding the distribution of water by water bowsers, and also an issue to do with diseases. Let me get back to Mr. Banda. I wanted us to create a picture so that as we talk about these cases that may be there, some of them may just be rumors circulating, we first of all understand the background of what is done up to where we are. Because I know for a layman like me who may not have watched all this happening, I'll have that mindset of saying they just go and draw water wherever they can without looking at all those that are supposed to be done. I remember, taking you back, you mentioned of Chipiola and some other places that were hit by these diarrheal diseases. Just kindly amplify that point. What other places you have noticed that there is this challenge currently?
All right. So thank you very much for that question. So in most cases, what we have seen is that these peri-urban areas, we have quite a number of compounds around the central business district. Yeah, that is where we are having quite a number of diarrheal diseases. And the reasons for this, they're actually known. If you go in these areas, you find that one, they're having toilets close to the shallow wells, which they have actually put up. And this is coupled with poor personal hygiene standards being practiced. And these are the issues that even as Minister of Health, we have actually tried to put in much effort to provide health education.
Maybe get hold of your thoughts, Mr. Banda. Hopefully this one is calling in line with our program. We are through to Kanele FM. Good afternoon.
Good afternoon. Steve, how are you?
Very fine, sir. How are you?
I'm fine. My concern goes to Eastern Water.
Hold on your thoughts, sir. Kindly.
Yeah,
hold on your thought. Hold on your thought. Share with us your name. We don't know you yet.
Yeah, me, I'm Mwanza Joel Joseph, senior citizen, retired.
All right. I must assume you're aware of what we're discussing, sir. Kindly go ahead.
The servicing of the community with the water bowsers, which has been adequately done.
Okay.
And for one, I recommend the stakeholders for coming together to alleviate the problem.
Okay.
And the other thanks may go to the manager at Damatwa and the head teacher, Lundazi Day and Petauke and Lundazi Primary, for having allowed the community to access water, even including the Roman Catholic Church. But my concern now is to the Eastern Water. Kindly let the community know that by Thursday this week.
Yes, Mr. Manza, go ahead.
Yes.
You're saying
Hello?
Thursday this week, what?
Yeah, we shall be getting our water bills from Eastern Water. Let the community not come up with it. Those other funny communities, the water that we already consumed before the water was disrupted from Eastern Water.
Okay.
You know, an African, especially Zambia, it's the water which we have already consumed that we need to come and pay. For Eastern Water to come and have the resources to continuously give us fresh and clean water. Otherwise, let him clarify that the bills are for the water that we already consumed.
All right.
You know, Zambia, he brings politics where there's no need of bringing politics.
Okay.
Politics. So that the stakeholders also work diligently as they have started. Thank you so much.
Thank you, Mr. Monza, for coming through. All right. I know Mr. Nyirongo will react to that, but we had to beg Mr. Banda to get hold of his thoughts. We were discussing places that have been affected by diarrheal diseases, and you were stressing a point to do with hygiene practices in those areas. Kindly go ahead.
Yes, please. So, as I was explaining, to say most of the affected areas are these peri-urban areas.
Mm-hmm.
Even the information that we have, if we go to our registers, because that is what we do.
Mm-hmm.
You go to the registers, we start isolating one case by one case, trying to find out where these cases are coming from. And that's how we discover that actually most of our peri-urban areas, they are actually affected.
Okay.
And as I alluded to earlier on, to say that these places, when we go down there, we've discovered that most of the places, they're having toilets and also shallow wells close to each other, which already, that in itself precipitates, the issues of diarrhea.
Mm-hmm.
Yes, and this is coupled with hygienic, personal hygiene practices that people do. For example, what I mean is someone goes to the toilet, you come back from the toilet, you don't wash your hands, you go ahead and start, eating food. That is not a good practice. Okay, that just accelerates how someone can actually get diarrhea. Maybe just to mention that the diarrhea that we get them through the mouth.
Mm-hmm.
Okay, we get them through the mouth. So meaning that we need to take care of the things that we put in our mouth. Okay, be it water, be it food. Yeah, so we just need to take care of that. And then in most cases, it's also through our hands, because we use our hands, to touch food, this and that, and then we eat. So if we don't take care of our hands, when we are coming from the toilet, we are preparing food, we need to eat food, then it becomes easy for someone to actually get diarrhea.
All right. Maybe let's get back to Mr. Nyirongo. Mr. Mwanza has mentioned something to do with the water bills.
Yeah.
He's even mentioning Thursday. Just your reaction to that.
Thank you so much. Today is what in terms of the date?
Today is the 12th of January 2026, a Monday.
Yes, and the Thursday will be 15th, I believe. So I'm trying to see Thursday as Mr. Mwanza. Yeah, so I really I'm impressed, to say the truth, because Mr. Mwanza has followed our calendar of meter readings and bill distribution very closely, because every month we do send the bills via SMS to our customers around that date, 15th of every month.
Okay.
And for this month, 15th will be falling on a Thursday.
Wow.
So I was like, this Thursday,
Where has he gotten it from?
Where has he gotten it from? So thank you so much, Mr. Mwanza. And let me also stress this point, that the bills that we are going to receive now do not carry the period where the disaster has happened.
Okay.
This is the consumption that we had in the month of December.
Okay.
If we can look closely, you find that the disaster happened towards the end of December. That should have been 29th, somewhere there.
Mm-hmm.
That is when the disaster took place. And at that point, we had already consumed the most part of December. So the full cycle was met. Okay. And those are the readings that you saw our people taking in the first week of January. And those bills will be ready by 15th of January. Okay. And as Mr. Mwanza has put it, they will be based on the consumption that we have already taken. Okay. As Eastern Water, we're making a very big loss from this disaster, because our plant is not working, and as a result, we are not accumulating any billing from any of the accounts. So this period is going to negatively affect the billing for Eastern Water and Mundazi, as I had already explained in the previous program. Okay. So you realize that we encourage our customers to understand that the January bill, which is expected in February, will be the one that will be able to carry the impact of the disaster. Okay. Yeah, thank you so much.
All right, let's get back to diarrhea because it's the elephant in the room. You have mentioned of ways that people are contracting this by ingestion. We are eating some food that is not well prepared or not well kept, and could be the reason for this. But we are attributing it to water because it is coming in a different way than the usual one we're expected to see, where you just open your tap, you get the water. But this is a different scenario now, a scenario that we don't fully understand how this water is getting into our homes. Just kindly share what the Ministry of Health is doing in this aspect in ensuring that there is no information gap between you and the people that are affected.
All right, yeah, so thank you very much for that question. Maybe to start with, I must explain that as Ministry of Health, we have structures on the ground.
Oh.
Okay, yes. So we have the District Health Office, which is looking after health facilities. Now I think we have 18 facilities, including the hospital.
Okay.
Now, from each of these health facilities, maybe apart from the hospital, these are the ones that we call a health post, a rural health center, including the urban health center. We have what we call neighborhood health committees, and these are actually existing in
NHCs.
In communities, yes, in communities. And this is a very good strategy in the sense that at health facility, you find that the health workers, they are not many.
Okay.
In as much as we can go in the field and wait and do some of these things, but we also rely on NHCs, neighborhood health committees. Within neighborhood health committees, we have committee-based volunteers. These are the people that we have actually trained ourselves.
Okay.
And we must thank the government again on top of this, because now they have also come up with a strategy. There are these people that we are calling polyvalent committee-based volunteers.
Okay.
Okay, who've been trained, and of course they are getting some bit of an incentive every month, which is a very good thing, and this has actually motivated them.
Okay.
So in short, I would say that we have eyes on the ground, meaning that where we are failing ourselves to reach, we easily get information and see in terms of how best we can actually work together at community level.
Okay.
Just like we are discussing issues of diarrhea, what is very critical now is the issues of, one, personal hygiene, as I alluded to earlier on, giving information to people. Issues of chlorine, of course, we are distributing chlorine, and I'm sure you should be interested to know that from the time that this disaster started, we've been assisted with quite a good amount of chlorine, to an extent that as of today, we've distributed 3,555 households. We have already given them chlorine, and this is continuous. Right now, as we are speaking, there's a team that has left, to go and give facilities, which we eventually also give communities. Now, I must clarify also to say, I know as we are discussing the diarrhea issue under Lundazi urban catchment area, we also have cases that we record, for example, in the Mwase area, or other facilities. They do record diarrhea cases, but like I've already mentioned, to say we usually analyze this information, and when we analyze, for example, the whole of last year, you find that urban is topping the list, followed by Mwase, and the reason is simple. Like I've already mentioned, you find that around the urban, because of these peri-urban areas, there are quite a number of factors that are happening there, issues of the things that are alluded to earlier on.
All right.
Yeah.
0776371293 or 0969928858 for your dear listener to come forth and be a part of this conversation. We are discussing issues surrounding diarrhea, as well as rumors circulating that, of course, this could be as a result of the water that is being distributed via Bowsers. We have a team of specialists that have explained to how this whole process is being done. Imwe mu kupenga kufumba kwa mafumbu, kukosekana na kapelekero kamaji, vantu vakupambana kulondozana na kusefukira kwa maji kwenye uko ukakwasa boma lino la Lundazi. Mungatuma phone sono pa 0776 371293 pa 0969 928858. Kulisoma humwe banyake bakaweyanga kuti yai kuyana na humwe haya banyake bakulwala pa mtima chifukwa cha maji gene aga kupelekeka ka imwe mwapulika konkhani yachi ene iyo mukapenga kuti bantu aba bavuire kuyo yapo pa makani aga. Let me throw this one to the panel. There have been rumors causing fear in the community. What message do you have for the public regarding this misinformation? Where do we start from?
Okay, so thank you so much.
Okay.
I think I can start. So I think I just want to add on what Mr. Banda was trying to talk about. So to the households that are drawing water from the Bowsers, the chlorine, as Mr. Nirongo has alluded to, is normal chlorine, and that's how it's supposed to be.
Okay.
But for those that are drawing water from shallow wells, they need to treat their water. Treatment might be by boiling or adding liquid chlorine.
Okay.
Yes. Then when they draw this water, they have to put this water in covered containers.
Mhm.
They have to ensure that the buckets that they're storing water in are covered,
Mm-hmm.
and maybe they use containers which have lids on them, because the bacteria that might come into these buckets, you may not see them.
Okay.
They just come here. Sometimes the child is from the toilet, they get a cup, they'll just draw water and without even washing their hands.
Okay.
Yeah. So also, I want to talk about the sanitary facilities.
Mm.
We've recorded some households that have their sanitary facilities collapsed. So these people need to quickly build these sanitary facilities, because if they do open defecation, it might lead to diseases being transmitted, especially cholera and other diarrheal diseases. So everyone should use the toilet, wash their hands after using the toilet, before eating, after eating, people should wash their hands so that to prevent these diarrheal diseases.
Okay.
Yeah. Then the other thing is we also disposing of our waste.
Okay.
Because I've seen in some compounds like Dunda, William, the way they dispose their waste, it's so indiscriminate that you find that the waste is accumulated with flies, and like Mr. Banda said, the flies are the ones that will cause, that might be a mode of transmission to cause diarrhea.
All
Yeah.
right.
Then also, there are some mothers who have babies. They usually change diapers.
Mhm.
So you find that mothers sometimes will just be, from changing a diaper of a child, they just prepare food without washing their hands. So we just want to encourage these mothers with babies that whenever they handle fecal matter for babies, they wash their hands to prevent this diarrhea that we're talking about.
Okay.
Yeah, otherwise diarrhea is very preventable so long as we practice personal hygiene, as Mr. Panda was explaining.
Okay.
Thank you so much.
All right. I want us to now get to the rumors. You wanted to add something away from the rumors?
Just on the same.
Okay. Maybe just get hold of your thoughts. Let's accommodate this one. Good afternoon.
Good afternoon, Clark. Jordan Joseph, back on red.
Okay.
I would like to find out from the panel. I remember sometime last year, there was a health task force which was put in place inspecting compounds such as Garoba, William A, William B, and Gabon. And I remember there's one landlord who was advised to take all his clients out of the area, because 6 of them were sharing a shallow pit latrine and had no passing shoulder. Now, how far successful have we been with that task force? Then on the issue of a diaper, what I know is that a diaper is an emergency. We are traveling to Lusaka. You can't have the napkins that you can wash on the way. But now, the general public has taken it as if it's something that they can be using for their babies. But babies have never used a diaper. If it doesn't show some material. But otherwise, the decentralization, if us as communities can work hand in hand with Ministry of Health and the Ministry of Local Government to spearhead the sanitary advocates. I know we can report very minor issues of diarrheal issues. Otherwise, I'm a very patriotic citizen. Thank you so much.
All right, Mr. Mwanza. We had to cut you short, sir.
Yes, so thank you very much. I just want to dispel rumors that are circulating regarding the outbreak, because people are just saying there is an outbreak. Okay, so as the Minister of Health, when there is an outbreak, we cannot keep quiet. We cannot cover it. In whatever way, if we try to cover it, it will still come out. Okay, so as the Minister of Health, we try to maintain our integrity by ensuring that if there is an outbreak, we communicate through the designated channels to ensure that the outbreak is actually declared. So now for Rundas, you may ask a question. Do we have diarrheal cases? Yes, diarrheal cases are there. We are recording them. But do we have an outbreak? No. At the moment, we don't have any outbreak in terms of diarrhea cases, because what we have seen so far, it is the normal trend of the diarrhea cases that we usually have. Of course, there is a slight increase, but now this slight increase that I'm talking about, earlier on, if viewers and listeners are following, I had mentioned that we had reached a point, for example, September, October, November, we had a lot of diarrhea cases, more than what we have now. But we moved in swiftly to put up interventions, and that's how cases went down. Right. So yes, we are recording diarrhea cases on daily basis, here and there, dotted ones from all facilities. But this cannot be attributed to us, like saying it's an outbreak. For now, it's a situation that is under control. Thank you.
I know social media. Someone wanted to...
Yeah.
Okay, please go ahead.
Thank you so much. I think I also want to add a word on the rumors that we have heard so far.
Yeah.
So, as Mr. Banda has put it, Ministry of Health monitors the disease trends every day. And for one to just wake up one day and declare that Lundazi has got an outbreak without the information from the Ministry of Health, then that is unfortunate. We would want to clearly state that the status in terms of the current status, as Minister of Health has put it, that is what is on the ground, and not what is going around on social media. So the other thing that I would want to talk about is that the source of water that we are getting this water from is not a surface source. It's a borehole. These are boreholes where this water is coming from. And in some cases, you find that people believe that borehole water is safe naturally. But because we believe that the processes that we are doing to transport this water to the people is also involving other facilities like the Bowsers and all that, that is why we are also adding chlorine to ensure that these Bowsers are safe. Okay. And so far, we do add adequate chlorine, and we test these chlorine levels. Those that feel maybe are not convinced, let them come. We show them what we do. Let them learn the processes so that we are able to move together. Yeah.
Maybe how active is this team? With the use of social media, people can just wake up and create a story and then it blows out of proportion. How ready are you to deal with such stories that may come from nowhere? You never expected it, but you are the team on the ground. You are close to these people. You know what they're going through. You know how this water is delivered. How active are you in ensuring that this information is dispelled there and then without giving it room to spread further?
So maybe to come in, the thing is, we know the reason why we're here. We are here because of rumors. Yes, so maybe what I can just say the topic that in this flood issue, as in we can help our people. But the thing is, in working together, there's also need to utter words. So we need to follow proper procedure than just to issue rumors and alarm the situation. So another plea is, if there's anything, I'm sure people have already seen the team. They can even go to the DC, to the council secretary, everywhere. They say, this is the issue.
Mm-hmm.
So, because after we heard the rumors, the team was on the ground to investigate.
Mm-hmm.
And according to what the numbers are, I'm sure you've heard the numbers from Minister of Health. The diarrheal cases, the diarrheal issues, they're just normal trends.
Mm-hmm.
And we even had higher cases as compared to September. In September, had higher than this time. Yes. So the team is very active. It's on the ground every day, and we are here to update the people. And all the help is welcome.
Maybe people think this whole process could be long. They can't easily follow through this, and they had to link up with them rumor mongers, as we may perceive them, to spread this information. What are you finding? Please go ahead.
Okay, all right. So I wanted to add on to what my colleague was saying.
Please go ahead.
And also for the information of the general public, I will give some figures. Earlier on, I said we have 18 health facilities.
Yes.
So from the time that we had this disaster, we've been recording diarrhea cases every day. So even today, I need to give an update through the Director of Health Services, and that information will go up province up to Ministry of Health level. So far, from 29th to today, yesterday, we've recorded 304 diarrhea cases from 18 facilities.
Wow.
So now, if you are to divide that 304 by 18 health facilities, you will discover that probably the number will be somewhere, maybe is it 13, 14 cases per facilities. But now, how many days? This is the cumulative. This is cumulative. From 29th December, today is 12. And if you divide by the number of days, you discover that probably each facility has been reporting 1 or 2 cases of diarrhea per day. Okay, I hope you are following. Because maybe just to repeat what I'm saying, to say from 29th December to last night, we've recorded 304 cases from 18 facilities. This is a cumulative number. It's cumulative. Meaning that if we are to divide by the number of days, divide by the number of health facilities, the issue is that it means each facility is recording maybe 1 or 2 diarrheal cases per day. So that's why we are saying we do not have an outbreak yet, but that is not to say that we have folded our arms. No, we are alert and we are monitoring the situation. And that's how we are even putting in these other interventions to ensure that we don't go into an outbreak mode. But what we can also encourage our communities is that just talking to say we have a lot of diarrhea cases here, that will not help us. Let them pass through, let them come through to health facilities.
How available is this information to the public? This is very important that people know of these cases. So even when there's a surge or there's a reduction, they will not be caught by surprise.
Okay.
Don't you think this information should be made available to the public as soon as it can be?
Okay, yeah. Actually, you are very right. I think this is just one of the platforms that we have chosen to use, so that at least the information can be out there. The public should be made aware that actually what they are hearing may not be the correct information. But maybe just also to encourage people to say, of course, people always talk, rumors always be there. But what is important is, for example, you are in a community, you find something, pass through our structures and report formally. Because by just going to social media and you start, alarming the nation, I mean, what do you gain by that? That doesn't help a lot. So in short,
a lot of people do that for numbers, of course.
Oh,
a lot of people should know about them talking about these issues. They don't look at the value, certainly, of saying the information is authentic and whatnot. Most of these guys, they just want numbers. This one has said this one has said that. But how do we discredit these if this information is not available in public? Because it's easy for someone when they have rightful information. For example, a credible media institution like ours, we have shared information from the Ministry of Health that these are the numbers. When they see other numbers elsewhere, they'll compare. This is a credible media house. I shared that it's actually 304 cases during this particular period. So whoever is going to give correct, they will refer to that and say, "This. Do you think we need to up our game in this particular aspect as well, so that people can easily refute some of these things? No, this is a lie. Other than us now chasing a lie."
Okay. Yeah, actually, you are right. You have said it all. I think that is the more reason why we decided even to come to radio, so that actually we dispel some of these rumors that we are hearing. I think that is just what I can say.
All right.
Okay. I just wanted to add to what Mr. Banda said. So you find that sometimes in the community, there may be people that maybe are having diarrhea. But what we encourage them is that they should report to the health facility so that they are treated accordingly, and we teach them ways in which they can prevent further diarrhea in the future.
Okay.
So in as much as people are saying that there is diarrhea, there's what? Us as health, we can only know if they've come to the facility. If they don't come to the facility, then it will just be a rumor for us. So we rely on them to come to the facility to seek early treatment, and also we give them the right messages so that they don't get further diarrhea in the community.
All right. I want the waterman now.
But I can also give an example on that one, just to arrive at what my colleague has said. There have been situations where we hear that in this village we have quite a number of diarrhea cases. Sometimes, always, let me not say sometimes, if this information reaches our office, we have a rapid response team that quickly goes to that village to verify whether the rumor that we are hearing is true or not. And in some of these villages, like I talked about the structures, we have people who we have trained in what we call event-based surveillance. Their role is to ensure that whatever they see that is of public health importance, they should be able to report. Using any means, they can report using a text, they can call, they can write a letter, so that the information should reach us. And now, once that happens, it is our duty now to ensure that wherever that has been reported from, we make a follow-up so that we verify whether it is a true event that is being reported or it is a false, statement that we've been told.
How effective is your team?
It is very effective.
Okay.
It is very effective.
All right.
Yes. There are a lot of examples that I can give. There was even a time when we received a phone call in the middle of the night from Kamilenje, and when we went there, we found that the situation was not all that good. But that's a story for another day. But all that I can say is that our team is actually very effective.
All right.
Yeah.
Mr. Nyirongo, I know issue of water 99.9% concerns you.
Yeah.
When you hear rumors of this sort, just share with us, how do you feel?
Yeah, so thank you so much, moderator. Being in the water industry, we take care of lives. They say water is life.
True.
Yeah. And when you are doing your best to ensure that you give the best to the community, and then you hear such a rumor, you find that it disheartens. Yeah, it makes you feel bad to say, but where is the problem?
Yeah.
Okay. So we get very concerned when we see such messages, especially unverified messages, which have got no source to point at. For example, if the rumors were stating to say Minister of Health has said that there is an outbreak of cholera in Lundazi, then it means that information is coming from Minister of Health. Even if someone comes up to actually share that information, it means that the Minister of Health has confirmed that there is that kind of an outbreak.
All right.
Then for someone just to wake up one day and use their own language to post on social media, we would like to encourage such people to actually desist from that, because we are dealing with people, we are dealing with lives, and those lives depend on this information to survive. So if we spread such rumors, we might end up causing discomfort in the people, and it might result in things that we didn't anticipate. So we urge our colleagues out there, we urge our customers and everyone else out there, and those that are peddling these rumors, to feel free, engage us as stakeholders who are managing these institutions, so that we are able to, together with them, ensure that what is on the ground is what is reported.
All right.
Yeah.
As we come at the very end of this conversation, just any word of importance, and use that as a closing point from the panel. Yes, please.
Okay. So thank you so much. I just want to urge the public that this water from the Bowsers is safe. Like Mr. Nyirongo indicated, the water is being treated, adequate chlorine, and the acquired chlorine that is put there is the one that is supposed to be put.
Okay.
So I urge everyone to just drink the water from the Bowsers and stay safe.
Okay. That's all we could accommodate on the program today. I've been your host, Stephen Nkoma. I was privileged to host the District Surveillance Officer, Mr. Stephen Banda, the Water and Sanitation Company Manager, Mr. Yotam Nyirongo, the Water and Sanitation Coordinator from Lundazi Town Council, Mr. Bunda Kalua, and not forgetting the District Health Promotions Officer, Mrs. Messi Pirimuke. Thank you so much for having tuned into the program. God bless you. Bye-bye.